This loan repayment program, which is administered by the John A. Burns School of Medicine, is one of the fastest and least expensive methods of recruiting healthcare professionals to provide services in underserved areas. It's now law in Hawaii as Act 58. Congratulations to all.
Thank you.
Thank you.
On behalf of the John A. Burns School of Medicine, it's a pleasure to be given the opportunity to thank you, Governor, and to our legislators for passing this legislation. It's one thing to bring students into the medical school and to train them as they transition to become a physician. It's another thing to recruit and retain them to practice when they are burdened with educational debt.
There's a national shortage of practitioners because of the amount of time and effort it takes to get trained to deliver health care. It is an expensive proposition to the individual. So having an opportunity for part of their educational loans to be repaid makes it much easier for us to recruit providers here to Hawaii where we need them greatly.
We're so pleased to see this bill pass because it's showing recognition of the importance of recruiting and retaining our primary care professionals in the areas where they're needed the most, and it's going to go a long ways to help meet the needs of those in the underserved areas of our communities.
So now we have our own program, our own homegrown program for young men and women who want to become doctors or nurses or psychologists to pay back their loans. It will make all the difference in our rural areas.
It's now law in Hawaii as Act 58.